here, of course, in Medellín. Medellín is, as you know, kind of like a combination of the Silicon Valley of Colombia.
It sure is, yes.
And now with the biotech that you're doing, it's almost like the Boston as well.
It is.
It's amazing
Yeah.
to see something like this, not just Colombian operated, but Colombian owned as part of Sura.
Yeah. This is, we're very proud of it. You know, we're very proud of it. And it's kind of my dream come true. I left Colombia when I was very young, 22 years old. I didn't know a word of English. I grew up in a very humble family, low-income family, but through education I was able to make it through, and I ended up in Wisconsin. So then, little by little, I learned English and loved school, did my master's, my PhD in Wisconsin, and I worked in industry in the U.S. I started my own company in the U.S. My mother told me one day, son, people in Colombia are dying of dengue, you haven't done anything, do something. Do something for dengue, try to figure that out. So what a challenge. So I started studying dengue, and with a friend of mine, created a company to make a vaccine. And I did it. I was successful.
Amazing.
And so that was like my moment of pride, and the vaccine is now in the arms of people. So at the same time, I said, I need to do something for my own country, my homeland. I've done this company somewhere else, and I need to do something here.
Right.
So it came COVID,
Oh, yeah.
And when it came COVID, Sura said, we need to do something. Because what's happened is that we're going to continue having these problems, these outbreaks, these things are going to continue happening in general. Sura said, we need to do something ourselves, we need to do something. So I came to meet with them, and that was my dream. I said, I want to do something for my homeland, and this is it.
It's amazing.
This is what you're seeing here.
It's interesting because there has not been, not just in Colombia, but in Latin America generally, not a large industry in producing high-level biologics. I mean, there are companies that do things like produce vitamins and some contract manufacturing, but not like the vaccines, which is a much higher tech than just saying, I'm going to produce a generic, I'm going to produce a vitamin supplement or something like that.
So, because look, the whole region is 650 million.
Yeah.
LATAM. That's pretty large, isn't it? And there's only 4 countries that make vaccines: Mexico, Cuba, Brazil, and Argentina. And they don't make enough for everyone. So there's a need to do this. There's a need to produce something that will provide more vaccines for the region, At the same time, my dream is that tropical diseases affect people around the planet. It's not just Colombia or Venezuela or the region, but mosquito-borne diseases, dengue, for example, affects people in Africa, in Europe, Spain, and Italy is having cases of that as well, and Asia as well. So I think what I like to see happening is that we export science and technology from Colombia. We put our brains to work, and we export science and technology to help folks in other parts of the world, and we can control diseases in that way. We can export our knowledge and our scientists. I'm very proud of the scientists that we have, the people that we have. What I also like to have is innovation, okay? And what I have done is bring technology that has been used, for example, the mRNA vaccines. We now can make mRNA vaccines here.
Messenger RNA,
Messenger RNA. We have many things that are tropical diseases. So, but also, some of those problems, big companies don't want to put the resources because they are so local, sort of thing.
Orphan disease or
diseases,
exactly.
We call orphan disease neglected tropical diseases. So my goal is also that, to create vaccines for this type of diseases that affect our population. And now that we see climate change and we see all these issues, we see that the mosquitoes are in Florida and they're in Texas and all those areas there. So I won't be surprised in the future if we have a major outbreak in the U.S. or something.
Then they start paying attention.
Then they will. I feel that also is what makes us feel really proud of it. That we can focus on our diseases, our tropical diseases, but they also can have impact. I was asked recently, for example, one of the vaccines that I'm working on could have a significant impact in Africa.
Yeah.
And we could actually do, it's hard to believe that, but it's going to be true. We will do technology transfer from here, from Colombia, to Africa.
Oh,
That makes me very proud too.
Exactly, because Colombia is now a donor country, whereas 50 years ago it was a recipient country.
Exactly. So we can change few things. but we can also be more involved in this global partnership, that we can be part of this network, and we are now part of this network that is also making vaccines and biologicals for all over the world. I think that's what we want to do. I want to show you what my dream is. We have all this space, okay? And we have access. We bought the land. This is our neighbors. We bought them from that family. And that family is actually very proud of doing this. We have areas here to grow that we can build. In addition to what we can do here, we have space that we can build more, and there's even space behind there.
Esa solamente es primera fase.
Yeah.
Que todo ese es espacio para crecimiento.
And you see, we have the airport right next door.
Yeah.
So as well. So many vaccines that we can make here.
You can ship them instantly wherever in the world.
Yeah.
Wow.
It's gonna be nice. So we have about 6 buildings. So that's the potential that for every vaccine we need to test to make sure the vaccine really meets the standards, the requirements that we need to do. This equipment took about 3 years to build. It was built in Germany. Bausch. Custom made for us, with a lot of sacrifice and pain from us, because we have to, deal with them here and there, bring the equipment here and make it work here. So, it takes a while.
And the idea is to begin production in April.
So we are basically going through the process of certification, what's called certification.
Okay.
And so the team here is preparing all what's called the dossier for the regulatory packaging for INVIMA to come.
Right.
INVIMA needs to come and inspect us.
And INVIMA is like the FDA.
Exactly.
Right.
The Colombian FDA. So that's what's going to happen. We are making a lot of progress in a lot of things. We very soon, probably, so number one, we're moving the facility into the INVIMA regulatory package. So INVIMA is going to come to visit. We had a major announcement with the government. We announced about a month ago that Vaxthera, the Ministry of Health, and the National Institute of Health, or Instituto Nacional de Salud, signed an agreement to build capacity locally for the next 10 years. So we're working together. Vaxthera will help the INS, or Instituto Nacional de Salud, to make vaccines as well.
Okay.
Because we cannot make all the vaccines ourselves.
Right.
And it's good to have partners.
Of course.
And to have them as partners of the government will be really good for all of us.
So, absolutely. I mean, not just for Colombia, but not just for Colombia, because when you increase capacity, then you're able to help your neighbors.
Totally.
And not just that, but the whole licensing agreements, because when you guys develop the intellectual property, then you can then go and license it, not just to other Colombian organizations, but around the world.
That's what we're doing. In fact, you got it right. We got last year our first patent, for a vaccine that would protect against different variants of COVID. And that vaccine now, it will protect also against Mpox. Mpox is a virus that is affecting people in Africa. So it's going to be amazing that we will support some African countries, to develop that vaccine, because we have made it here. Okay.
Amazing.
And I want to make the case, to see why this could be a good investment, because some people might be afraid of investing in LATAM, I'm so happy with Sura, because when Sura we had this discussion, there were some people here in Colombia that were skeptical, saying, those guys are not going to do it,
Right.
They're never going to be able to do this, okay? Or also, where are you going to find the people to do this? Right? So
you're proving them wrong.
Exactly right. So we're very happy with that.
So I see 15 April, that's coming soon.
Yeah, so that's where we have the deadlines where we want to submit packages. We are doing all that stuff,
Wow.
But it's going really well.
What do you expect to be, and I'm sure it depends based on, like one vaccine has a higher...
We expect next year to have vaccines with the label Vaxthera.
Okay.
Next year, and hopefully the government will approve them.
Oh,
we should be in good shape. So this also something that makes me proud. And I'm also hosting a scientific event. I'm part of a scientific network. That I want you to know that it's called Pan Dengue. It's been April 21st to the 24th. And there are going to be scientists from all over the Americas coming here.
Oh, great.
There are going to be scientists and we're going to keep hosting events here. There are going to be scientists from Europe, from Africa coming here as well.
It is just so impressive to see this happening right here. And even more so, it's not like some big company from
Yeah.
Europe or the U.S.
Or China.
said we're going to put a factory in Colombia, which is good. You know, that's great. That's fine. But no, but this is actually Colombian.
That's right.
And that's what's so cool.